Hi everyone, here's a brief tutorial on assessing interpersonal and communication skills with the PARS version K, K standing for Kanazawa. So as you know, we're going to be working with a group of Japanese medical students and perhaps even a resident or two, and we've been working with this group for, I guess, 7 or 8 years now. So let's go over what you're going to be doing. PARS version K, a little different than the PARS that you may be familiar with, those of you that have worked at NYIT. So it has 6 dimensions and 5 rating points. And so one of the important things to keep in mind is that when you're scoring, I would pull this guide out to refamiliarize yourself with the dimensions if you're not sure. And also it's important to rate one dimension at a time because there could be a variation in what they're actually doing. They may be able to elicit information in a really low quality way, but their nonverbal communication compensating for their English proficiency may be also, though, very high. So you want to really make sure that each dimension gets its own separate rating. The other thing to not really consider is issues such as the circumstances of the exam. For example, that they were tired, they were nervous, they were trying so hard, and that you feel bad for them. So it's important that you score the learners on their merits and not the circumstances of the situation. These scores will help their English language teacher, Andrew Schneider, who you'll meet, to give them the appropriate feedback and guide them in learning English in a more proficient way, which is why they're here this week with us. So what you're going to do is make sure you rate the entire encounter from start to finish. Some people start slow and get better as the encounter moves forward, or the opposite. They may start strong and weak. So anyway, you want to rate the encounter from the time they walk in the door until time is called. We have 5 dimensions for you to rate. One, mostly lower quality communication skills, means that it's predominantly low quality, but there may be some rare instances of higher quality communication. Usually in rating communication, it's rare that people will do everything poorly. So you're looking for what's predominantly lower quality with maybe 1 or 2 instances of higher quality communication behavior. Likewise, on the opposite end, it would be mostly higher quality communication skills with rare low quality skills. So the way I've illustrated it here shows just a proportion that you would consider of lower or higher quality communication skills as you're going to rate on PARS, with a 3, about a 50-50 split between lower and higher quality skills. The guide that we've given you gives the dimension definition at the top and some examples of lower quality and higher quality performance. So I'm going to review these briefly to give you an idea of what we're looking for. So with rapport, it's establish and maintain a relationship that is positive, collaborative, and respectful, which would include a courteous opening and closure. So for the opening, you would hope that the students would introduce themselves and ask you what you would like to be called, and at the end, thank you, and leave the room in a courteous way and not just turn around and leave. Consent to examine. This is asking permission to examine you in a courteous way. Is it okay if I examine you? Of course, you'll go through an examination if that's part of the program for the day, but you would look for that consent to examine. Collaborative. What do you think of our plan? Meaning that instead of just simply prescribing a plan, they would give a plan and then they would review that with you. What do you think about our plan? Does that sound good for you? Is there anything that you would like to talk about with this? So you'd want to have some level of collaboration, which is a patient-centered approach to working with patients. Then with empathy, compassionately explores your medical problem and life situation. And so they will usually have no problem in examining your medical problem, your symptoms, your medical history, and so forth. The other thing, though, we're looking for is interest and curiosity in your life situation. how you're dealing with your medical problems, how it affects your life, the context of the problem, putting you in the context of your complaint. And so, if the medical problem is the disease that they would explore, the life situation would be the illness part of it. How are you coping with the disease? So, empathic approach would include connecting with the patient in some way, connecting with you in order to understand your condition or situation. So, connecting empathically would include expressing concern for your problem. I'm really sorry to hear this. You look like you're uncomfortable. Responding to your discomfort or mood. And again, the genuinely saying, I'm sorry, but not superficially saying it, which is more of a sympathy statement rather than empathy. Empathically exploring would include exploring your healthy and risky behaviors in detail, your subjective experience of your condition. For example, what's it like for you? Or your health beliefs. What do you think is going on? Elicit information clearly. Ask questions in an articulate, straightforward manner. So it's not so much what is asked, which would be a checklist item, but how is the question asked? And a couple rules for this. You would not consider scoring, well, they asked me all the right questions. No, that's not what we're looking for. The right questions would belong on a checklist, which would measure some sense of clinical judgment. They could be talking to you and asking you about what you did for the weekend for the entire encounter. And if they ask those questions articulately, you would give them a high score, but not consider whether they were good questions or not. Or if your case, which you would know very well, you would not consider whether or not they should have asked you certain questions. Again, it's not what they ask, but how they ask. They may present with some accent and grammar issues, which would be an English language proficiency issue. These two things are probably related. You would look for a mix of open-ended questions, which would ask you to elaborate on some information, how you're feeling, what's it like for you, and so forth. But also some closed-ended questions, which are necessary to clarify information. So you want to look for both of those types of questions. And for example, what brings you in, which would be open, when did it start, which would be closed, very specific answer required. Open-ended, describe the pain versus where does it hurt, again, which is very specific. Also, we're looking for them to avoid leading questions. No weight gain, no heart disease in your family, no high blood pressure, no surgeries. Then there are the confusing questions. Are they asking a lot of questions that are confusing? And again, this could go back to grammar issues where they're constructing the questions in such a way that really don't make sense to you. So it's important that you don't try too hard to understand and make sense out of them, because you probably will. You'll probably pick up the gist of what they're asking you. Your job, though, is to analyze how well they're asking these questions. Avoiding and explaining jargon is an important issue, too. They could use jargon as long as they explain it. They could be less articulate in a number of ways. For example, by mumbling, having their head down. This may be separate and apart from their English proficiency issues. It may be a style of speaking that they have in Japanese as well. So if they're mumbling, that's a consideration for eliciting information. Actively listening. Listens and responds appropriately to the patient's statements and questions, clarifying, exploring, interpreting, and evaluating what is heard. So one thing that they may want to do is take notes, and it's good if they would say something like, I'm writing, but I'm really listening to you, which would indicate that they were listening. However, just making that statement doesn't let them off the hook if they stop acting like they're not really listening to you in terms of their body language, turned away, and so forth. So they may make that statement in order to tell you that they're actually paying attention. They may use some active listening techniques. So these are things that you would look for. For example, repeating your words or phrases, or paraphrasing, taking your words and reformulating them into their own language. Not Japanese, I mean, but into their own statements. And reflecting, meaning that they repeat back exactly what you've said word for word. So these are active listening techniques that you would consider and look for. Asking follow-up questions either immediately or later, and this is one way of knowing that they're actually listening to you. Medical students are often really good at asking a series of questions, but because of the stress that they're under or their lack of experience, they don't often listen to the answers. And so with follow-up questions, it would be one way of getting evidence that they've actually been following the conversation. So look for that. Another way is if they summarize your information correctly, and it should come probably at the end of the history or at the end of the entire exam where they sum everything up. It's not just simply these little mini summaries or repeating back what you've told them. It's really summarizing a large piece of information. Exchanging information where they would orient you, the patient, to exam procedures, providing information, educating and counseling you in a clear and timely manner. And again, this could be affected by their accent or grammar. In many ways, this dimension is closely linked to eliciting information. So you're looking at how well they can explain things. So there may be a relationship between a score here in information exchange and how they score on English language proficiency. So they would make orienting statements, which are important. For example, setting an agenda at the outset, telling you exactly what they would like to do, or moving you from one part of the examination to the other. So orienting statements talk you through the exam, orient you to where you're going, and patients like that when doctors help them to figure out what's coming next and don't just surprise them. Or if during a physical examination they tell you that they'd like to check your heart and lungs, and it asks if that's okay with you. You have specific cases that may require some specific counseling. So for example, if you were a smoker, they may advise you to quit smoking. So look for that under information exchange. They may provide some case-specific information. So again, if you're a cigarette smoker, they may say something to the effect of, did you know that cigarettes have 250 cancer-causing chemicals? You don't evaluate whether or not the information is correct. You just want to evaluate whether or not the information is clear. Like the eliciting information dimension, you're looking for clear, jargon-free explanations. And again, it's okay if they use jargon as long as they explain what they're talking about. And finally, you want to look for that strong closure where there's a specific plan with a time frame. We'll run some blood tests to check your sugar, and then I'd like to see you again in 2 weeks. Or on the opposite end, which is lower quality, just week closure, a vague plan, no time frame, and if you were the patient, you'd be wondering, well, what are the blood tests for, and when are we going to do it, and when do I need to show up to do this, and so forth. During the physical examination, clear explanations, for example, explaining procedures. This is what I'm doing and why I'm doing it, and very important is giving the physical examination findings. If they're going to examine you, they should be giving the results of the examination itself. And finally, using appropriate nonverbal communication, where they're using appropriate gestures, signs, and body cues to compensate for or enhance their verbal communication. So one thing that we would look for is, perhaps under active listening or just during the entire encounter, are they really seated in front of you, whole body listening, face squarely in front of you, making eye contact, not fidgeting around? Their professional posture, do they come into the room and do they look like a doctor, or do they look like a nervous medical student? And in many ways, their nonverbal communication may communicate more than their verbal communication. So it's important when rating all the dimensions to look at the nonverbal communication that goes with it. Do they violate your personal space, or are they appropriately close to you or appropriately distant from you? You want to just make sure that the boundaries are appropriate and that they maintain your modesty during a physical examination by, for example, draping you or making sure your exam gown is closed up after the examination. And with that, I'd like to thank you and see you soon.